In this video, we're walking through a series of questions on cardiovascular medications. Whether you're a pharmacy or nursing student or getting ready for the NAPLEX or NCLEX, these questions might be very helpful for you. Hey everyone, it's Dr. Jess. Welcome or welcome back to my channel. If you're new here, don't forget to like the video, subscribe to the channel, and turn on your notification bell so you don't miss out on any new uploaded videos. Okay, let's get started. Question 1. Which of the following is a beta 1 selective beta blocker? So you can try to take a few seconds. If you know the answer, you can write the answer in the comments and then we'll go through it together. The correct answer here is C, metoprolol. So let's explain why the other answers are incorrect. So first, metoprolol. All of these are beta blockers and in LOL. And metoprolol is one of the selective beta blockers. So that means it's selective for beta 1 receptors, which are mostly found in the heart. Another example of a selective beta blocker would be atenolol, for example. Now, when we talk of non-selective beta blockers, there's multiple different ones. So propranolol, for example, is blocks beta 1 but also beta 2 receptors. So beta 2 receptors, for example, are also found in the lungs. And carvedilol, for example, blocks beta 1, beta 2, but also alpha 1. So alpha 1, that's the blood vessels. So you get some of the vasodilation with carvedilol that you don't get with some of the other beta blockers. And then labetalol is also a non-selective beta blocker. So it has beta 1, beta 2 blockade, and also alpha 1 blockade. Question 2. Which of the following medications is most commonly associated with a dry cough? Again, if you think you know the answer, take a moment, write the answer in the comments, and then we'll answer it together. The correct answer here is A, lisinopril. Now, why is that? So lisinopril is an angiotensin converting enzyme inhibitor or ACE inhibitor. How does lisinopril work, or how do ACE inhibitors work? They inhibit the conversion of angiotensin 1 to angiotensin 2. So ACE is that enzyme that converts angiotensin 1 to angiotensin 2. So by inhibiting that enzyme, they inhibit the conversion of angiotensin 1 to angiotensin 2. Now, ACE, that enzyme also breaks down bradykinin. So a medication like lisinopril inhibits the breakdown of bradykinin. What that does is that it builds up in the lungs and that can cause a dry cough. So this is kind of why ACE inhibitors are usually associated with a dry cough. Question 3. Which of the following medications is a thiazide diuretic? You know what to do. Write your answer in the comments and then we'll see if you're correct. The correct answer here is B, chlortalidone. So chlortalidone, also let's say hydrochlorothiazide and dipamide are examples of thiazide diuretics. Now the other answers are incorrect, so let's see why. Valsartan is an angiotensin receptor blocker. Spironolactone is aldosterone receptor antagonist, which is also potassium sparing diuretic. Torsemide is a loop diuretic. Question 4. What is the primary mechanism of action of lisinopril? Drop your answer in the comments. You should get this one right. I actually forgot that I had this question in there and I just answered this. So you should get this right. And as we said earlier, the correct answer is B. So lisinopril is an ACE inhibitor. It inhibits the conversion of angiotensin 1 to angiotensin 2. Last question. Which of the following is the generic name for Diovan? Write your answer in the comments and then we'll see if you're correct. So the correct answer here is D, valsartan. Now let's take a look at the other options. A, carvedilol is the generic name for Coreg. Losartan is the generic name for Cozar. Enalapril is the generic name for Vasotec.